Hi everyone, this is Abdul Chaudhary from Starling Diagnostics, and with me, Dr. Nawaz Hussain. He's also the medical director of Starling Diagnostics, as well as primary care, as you all know. Today we are going to be talking about something very interesting. We're going to talk about dementia. What is dementia? Who gets dementia? How does it get diagnosed? And so on and so forth. Dr. Nawaz, what is dementia?
So dementia, how you doing? So dementia is basic terms, memory impairments, but it's not just memory impairments. You have a decline in cognitive function. You have a decline in overall functionality
Can you tell us
also.
what is cognitive function? Like just
So thinking ability, judgment, how to process things. So that's cognitive function.
okay.
Dementia would be like, say, for example, you know how to do things and then you forget how to do things. So, for example, how to ride a bike, for example, they would be not able to perform the same way they used to do before. Like how to cook, they forget how to cook. Like they used to cook before, good meals, but now they don't know the process. There'll be, they would have other symptoms like, main symptoms is forgetfulness, right? So they forget names of family members, close family members. They get lost outside. They cannot find their home, right? So places that are supposed to be most familiar to you, for example, your workplace, and you come and then you don't know where you are.
Suddenly you're just like lost,
So,
basically.
yeah, so and then all of these overall impairs your functionality during the day. Sometimes they can even forget how to use the bathroom, how to shower. They forget those. So that's bigger terms. Those are like dementia criteria.
I understand. Okay, so who gets dementia? Is it like an age thing or?
So there's everybody forgets things here and there, right? I forget, you forget. So sometimes it's okay if you forget, say your childhood friend's name, for example.
That happens to me all the time. I forget people's names.
And then sometimes you could misplace things. If you put your keys somewhere, and
is that dementia or it's just?
So no, so that's normal. So there's normal aging also. Sometimes they could forget, somebody's name, but with thinking they can come back to it. So that's normal aging. It's not really dementia. Then there's a fine line between normal aging, normal memory loss due to aging, and then there's dementia. There's a fine line in between, which is called mild cognitive impairment. This is where you frequently forget names. You frequently forget events. But it doesn't affect your overall daily function. You're still able to function. So that is called mild cognitive impairment, meaning mild impairment in the thinking process, right? And then when it's more severe, that's the dementia criteria. So those are the people who forgets family members, forgets how to do things, forgets how a stove works, for example. They can participate in a conversation, but they can't really know what the topic is. They don't remember what the topic is. They forget. They pause frequently. They cannot recall words.
Is it fair to say it happens with age mostly, or it could be hereditary from family, or is it a genetic thing?
So there's some genetic links. Overall, 40% of the people at some point in time after age 65 may have some memory impairment, which is not bad, but to about 5 to 10% of the people will develop dementia. So not everybody gets dementia with age. There's different types of dementia. There's like Alzheimer's dementia, Lewy body dementia, then Parkinson's related dementia, vascular dementia. So a lot of the other types. Alzheimer's is majority of the dementia patients are Alzheimer's, like about 80%. And there's some genetic links associated with it also. And then other dementia has some genetic link also. So if your family member, one of your family member has dementia, then you may be more prone to getting dementia as well.
Thank you very much. That's it for today. Again, this is Abdul Chaudhary and Dr. Nawaz Hussain from Starling Diagnostics. If you have any questions or comments, please let us know. We'll see you next week.
Thank you.